When a young person screens positive for suicide risk, there are things you can do to keep them safe. Lethal Means Safety Counseling is one evidence-based tool that reduces youth suicide risk. In this video, I'll show you how to partner with patients and families to keep dangerous items out of their environment before a crisis occurs. Lethal means are things like firearms, medications, or other household items that can be fatal in a suicide attempt. In a moment of crisis, preventing access to these items can increase the likelihood of survival. Pediatricians are well positioned to counsel families on access to lethal means as part of a comprehensive suicide prevention strategy. Anytime a patient screens positive for suicide risk, it's important to talk about access to lethal means. The goal is to help the family think about ways they can make their environment safer before a moment of crisis. This helps prevent their child from acting impulsively on suicidal thoughts in the moment. Lethal Means Safety Counseling should be proactive, tailored to the patient and family, non-judgmental, and grounded in trauma-informed care. It's important to be mindful of a family's beliefs, values, language preferences, and lived experience. Discussions about firearms or medications are shaped by many things, including community norms, parents' jobs, or the medical needs of other people in the household. It's important to listen, to use respectful language, and to invite families to share what feels realistic and acceptable in their home. Counseling about lethal means in a way that centers safety, avoids blame, and focuses on temporary protection during a vulnerable period can increase a family's willingness to implement precautions before a crisis occurs. Let's say one of your teen patients screens positive for suicide risk. Based on a brief safety assessment, you determine they are not in immediate danger, but have a moderate risk of making a suicide attempt and require further care. This is the time to talk about lethal means safety. After the assessment, talk with the patient about the importance of involving their parent or caregiver in this conversation, and ask them how they'd like that conversation to go. You can also ask if there's another trusted adult they would like included in their support system. Then bring the parents or caregivers into the conversation to talk about your next steps for care. You might say something like, "Jamie shared with me that he's been having suicidal thoughts. Today, I'll work with you on ways to reduce his distress and help him feel better. While we're doing that, I also want to talk about steps that you can take at home to keep him safe." If the family expresses concern that they're being singled out, you could say something like this. "When one of my patients shares that they've had suicidal thoughts, I routinely suggest a few ways to help keep things safer at home. I'm not saying this to alarm you, I'm just saying it so that you can be prepared. Think of it as similar to when a pilot says, 'In the unlikely event of a water landing, here's what you do.' Then talk with the family about specific lethal means in their home and ways to keep their child as safe as possible." Let's talk about firearms. This is a critical topic. 90% of suicide attempts with a gun are fatal, compared to 4% of suicide attempts that do not involve a gun. Talking about guns can be tricky, so it's important to start the conversation in an open, sensitive way. Avoid typing notes or looking at the EHR system. Instead, focus your attention on the patient and family in front of you. Ask both the patient and parent about access to guns in the home in a calm, non-judgmental way. With the patient, you can say something like, "When people are struggling in ways you've described, I always ask about their access to guns. How easily are you able to get a hold of a gun at home or anywhere else?" With their parent, you could say something like, "If you have guns at home, what some parents do when their child is struggling is temporarily store them outside of the house. For example, at a relative's house or a gun shop. What do you think about an option like that?" If a family is willing to talk about their firearms, work together on a plan to remove the gun from the home. Different options may work for different families. Consider temporary storage at a relative's home, a shooting range, a gun shop, or a storage facility. Prioritize collaboration. Use open-ended questions to understand a family's concerns, values, and ideas. Emphasize that these measures are temporary and focused on protecting their child during a period of elevated risk. If removing firearms from the home is not possible, introduce secure storage as the second safest option. Talk with the family about how firearms are stored and ask them to reflect on ways to limit access. This type of conversation allows the parent to uncover safety risks themselves, which improves follow-through. When discussing secure storage, there are a few key points to hit. Firearms should be stored unloaded and locked. Ammunition should be locked up and stored separately. The patient should not know the codes to the locks or the location of the keys. When possible, firearms should be disassembled with key components stored separately. Consider combining a cable lock which runs through the gun itself, along with a lockbox to store the gun inside. You may find that some families keep firearms for self-protection. In these cases, they may feel that storing them unloaded is not feasible. Suggest a secure storage option, such as a quick access lockbox or biometric safe that can be opened only with an authorized fingerprint. In all cases, remind families that hiding a gun is not secure storage. Many children know where guns are kept in their home, even when their parents attempt to hide them. Next, let's talk about medications. Although medication overdoses are less lethal than access to firearms, they are critical to discuss. Overdose is the most frequent method used in suicide attempts. When talking with families about medication safety, explain that both prescription and over-the-counter medications can be fatal during a suicidal crisis. Work with them on a plan to keep only the medications that their family needs in the home. Ensure access is limited to quantities that, even if taken all together, could not do serious harm. The rest should be locked up or properly disposed of. Ask the family to think about where medications are stored in their home. This is typically a bathroom cabinet. Offer tips to prevent access, such as locking up medications in a lockbox that their child does not have access to, limiting the quantity of medication stored in the home to reduce the chance of an overdose, safely disposing of medications that are no longer needed or expired, purchasing over-the-counter medications in blister packs instead of bottles. Blister packs can slow down access to large quantities of medication in a crisis. You could say something like, many common medications can be fatal in a suicidal crisis. This includes things you might have in your home, such as prescriptions, over-the-counter medications, or insulin. I'd suggest going through your medications and getting rid of any that you no longer use. Keep only a small quantity of those you need on hand and lock up the rest. Do you have a locked cabinet or box where you can store them? This type of framing provides direct, actionable recommendations that build confidence and clarity. Finally, let's talk about other household items. Many common items found in the home can be lethal in a suicide attempt. While it's impossible to plan for every scenario, you can still help families think about access to items like alcohol, illicit drugs, household cleaners, inhalants and canned air, carbon monoxide or car exhaust, antifreeze, knives, razors, or other weapons, ropes, belts, or plastic bags. If a patient's suicidal ideation focuses on a specific method, help the family think through ways to temporarily remove these products from the home or store them safely. Unfortunately, it's virtually impossible to remove all potentially lethal items from the home. Youth may need closer supervision in order to stay safe while working on a more comprehensive treatment plan to address their suicide risk. If a parent expresses that keeping their child safe at home does not feel possible, help them seek care for an emergent evaluation. During discussions about suicide risk, be aware that stress, fear, or past experiences can come up. Symptoms of trauma, such as hypervigilance, impulsivity, or emotional dysregulation, can affect how the patient and family hear and respond to your safety recommendations. Support the family's experience and agency by working together to identify solutions. Incorporate trauma-informed care principles by centering trust, transparency, collaboration, and choice. Be intentional with your language and avoid making the families feel judged or shamed if they cannot remove all lethal means from their home. For example, you might ask, do you have any concerns about the plans that we've talked about? Do you foresee any challenges? What other options would you consider to keep your child safe? Think through barriers together and brainstorm alternative solutions. Once you and the family have agreed on a plan, it's important to provide clear next steps, document the plan, and schedule a follow-up. Reiterate the safety strategies that you and the family have agreed to, and explain how you'll follow up. You could say something like, as a next step, you'll remove the guns from your home and store them with your brother temporarily. You'll also store medications in a locked cabinet. I'll follow up with you by phone in 2 days to see how this worked for you. Do you have any other questions? Then, send the family home with other resources, such as information on the 988 Suicide and Crisis Lifeline, a safety plan, or a referral to a therapist or a counselor. Anyone in your practice can follow up, so find a workflow that works best for your team. And when you do follow up, ask if the plan was successful. If they ran into any barriers, suggest alternatives and set up another follow-up conversation. Most importantly, assure the young person and their family that you care about their mental health and are here to help them as they navigate this challenge. When lethal means safety counseling is collaborative and non-judgmental, patients and families feel empowered to create safe environments. You are the expert in their health, and they are the expert in their experience. Together, you can come up with strategies that are realistic, meaningful, and effective. To learn more about lethal means safety counseling, visit aap.org/suicide prevention. For other tips on safety planning, check out our video, How to Create a Suicide Prevention Safety Plan.